I have breast cancer.
I have breast cancer.
I have breast cancer.
And I needed someone to talk to.
I needed information.
I needed to know I could do this. I found Living Beyond Breast Cancer, an organization that understands what you need and need to know. They helped me, and they can help you too.
I have breast cancer.
And I have support.
I have information.
And I have hope. I have Living Beyond Breast Cancer. Find 5 ways we can help you at 5ways.lbbc.org.
Thank you so much. Thank you. And welcome, everyone, to Living Beyond Breast Cancer's 360, Living Well After a Breast Cancer Diagnosis, Practical Tips for Young Women. I'm so pleased to be here tonight in beautiful Boston, Massachusetts, with our partners here at Dana-Farber's Young and Strong program. They've been wonderful, wonderful partners on this program. My name is Janine Guglielmino, and I'm Senior Director of Programs and Partnerships at Living Beyond Breast Cancer, and I'm pleased to be your moderator tonight. On behalf of Living Beyond Breast Cancer and Dana-Farber, I'd like to acknowledge the Centers for Disease Control for the cooperative agreement that we both have with them that makes programs like this possible for young women. As you know, tonight we'll be discussing side effects for young women with breast cancer. This is a very important issue that really doesn't get as much attention as it should. And we'll be focusing on a few specific issues, but we'll try and cover the range of what we can this evening. So with that, I'd like to introduce our panelists for the discussion. We have Dr. Ann Partridge, a medical oncologist, member of Living Beyond Breast Cancer's Medical Advisory Board, and the founder and director of the Young and Strong program of the Susan F. Smith Center for Women's Cancers at Dana-Farber Cancer Institute. Welcome, Dr. Partridge. I'd also like to introduce Julie Salinger. She is a licensed independent clinical social worker here at Dana-Farber. We'll be speaking with her. And last, but certainly not least, I'd like to introduce our 3 panelists who are personally impacted by breast cancer. So you'll be hearing more about their stories tonight. I'd like to introduce Alexis, Kristen, and her husband, John. Thank you all for joining us this evening. Dr. Partridge, let's start with you. Your practice focuses on young women. You've seen hundreds of young women in your practice over the years. What are some of the major side effects that women report to you?
So young women, when they're diagnosed with breast cancer, can face a number of side effects. It really depends on both the treatments they receive as well as how their bodies and their minds react to any given treatment. And I would say the first thing is the diagnosis, which of course isn't a treatment, but the diagnosis itself, as any young woman can tell you that's been through it, it can be a real punch in the face. And so right there, you're dealing with a lot of emotions, and some of those can translate to physical symptoms and side effects. When we get into treatment, things like breast pain for any breast surgery or body image changes are really, really big for all patients, but particularly for our youngest patients. When it comes to chemotherapy, if someone needs chemotherapy, and the majority of young women do end up taking some chemotherapy because it's helpful in terms of getting rid of the cancer or treating it. Chemotherapy has lots of different side effects. It depends on the recipe, but hair loss, huge for our young patients. Difficulty with nausea can be harder for young women. Mm-hmm. Those are just a few examples. And then finally, the hormonal therapies, which particularly for young women can be associated with hot flashes, sexual dysfunction. All of the treatments can be associated with fatigue or tiredness, and that's just a smattering, a sampling of what can happen.
And we'll be talking about all those things this evening and some of them in more depth, so thank you. Now, Julie, I'd like to turn to you. Can you talk a little bit about your role on the care team?
I'm a clinical social worker, and I work alongside the medical oncologist and the surgical oncologist to provide support and psychoeducation to families, to patients, and caregivers.
Wonderful, thank you. And Julie, what are some of the major emotional issues that young women report to you?
Young women have all the same issues that everyone else has, plus some. For example, body image is a big issue with people. Fear of fertility is a big issue with people, with young women. concern about dating, relationships, talking with your young counterparts who are healthy and leading sort of more normal lives and trying to relate to them. Independence is a really big one because often the young women have just become independent and moved out of parents' houses and suddenly they need their parents again. So sort of learning to negotiate that is difficult.
So a lot of issues and many that are unique to young women. So now I'd like to turn to our panelists who have been personally affected to hear a little bit about their stories. And we're going to start with Alexis. Alexis, thank you so much for joining us tonight.
Thanks, Janine.
Can you tell us your story, please?
Sure. Back in January of this year, I was diagnosed with stage 4 breast cancer. I'm HER2 positive, and I was 33, so obviously that was quite a shock. I have lived a healthy lifestyle. I've been really active. I have no history of breast cancer in my family. I've never even broken a bone. I've never had a major surgery. So going from being really healthy to all of a sudden having such a serious disease was really challenging. And in those first few days, first few weeks, I found some really great webcasts and videos on the Dana-Farber website. I was desperate to find someone else who was going through this, another young person, and I can't tell you how comforting it was to hear what they did to cope and how to get through those first few moments. So if I can provide that today, any comfort or any insight, I would feel very happy about that. And right now I've completed 18 rounds of chemotherapy. And right now on my scans, it shows no evidence of disease. So we've done a big jump from January till now. So I'm very thankful about that, yeah. Thank you, Dr. Partridge, thank you. And next week I'm starting a trial, so I'm excited about that.
Thanks for sharing your story, Alexis, and thanks for sharing that good news. Now I'd like to welcome Kristen. Kristen, thank you so much for being with us tonight. Why was it important for you to be on this panel this evening?
It was really important for me to be here as well, and very much like, Alexis, I was always very active, ate very well, exercised. I was a little bit older when I was diagnosed. I was 40 years old. At that point, I had twins who were 19 months old, and my youngest son was 3 months old. My breast cancer was discovered after I had my youngest son through a routine exam with my gynecologist when he found something that he thought was a little bit concerning. And he said, "You're 40, you just had a baby, let's go have your first mammogram." So I did, which left me in a situation where I was in biopsy after biopsy. And ultimately I received a phone call that said, "Kristen, you had breast cancer." I was shocked, I was in disbelief. I had 3 babies under 2 years old. And I just, from that day, questioned myself and my mortality. I was scared and devastated. So fortunately, I sought out the best of the best. Dr. Partridge is amazing. And she just took me under her wing, and we set up a treatment plan. I've been through so much from my diagnosis in February 2015. I went through multiple rounds of chemotherapy, surgery, more chemotherapy, radiation, and more chemotherapy. And this month I can say that I'm now 2 years cancer-free.
Thank you so much, Kristen, for sharing your story. And now I want to turn to John, who's been waiting patiently. We've made the man wait until the end, but we'll introduce him now. John, can you tell us why you decided to join us on the panel this evening?
Mainly just to be here for my wife and to show her support, and just any other caregiver out there that, wants to know what to do and how they can help. And I found that just being there through the dark days that we have together and we had by ourselves, I just found that try to keep things light, is because there are so many days that are just, you dwell on it and you dwell on it. And I just found that humor for me and for us humor was the best medicine. It really, really did help bring us together even that much closer. So just be there and don't be afraid to ask questions. Always, there's great people here, great support, and yeah, that's pretty much it.
Great. Well, thank you so much, Don, for being with us. And we'll be talking also just about the impact of a breast cancer diagnosis on caregivers tonight, because they're an important part of the support team. So we have a lot of things to discuss tonight, so we're going to dive a little bit deeper into a couple of issues that folks have mentioned and that we have talked about. So I think we'll start off with an issue that is very important to many young women, which is body image. And I wanted to just ask you, Julie, if you could speak a little bit about some of the body image issues that women bring to you in your practice.
Well, as we said before, body image can be very difficult for young women. What I hear often is people saying, I really should feel that this is okay, that having a mastectomy isn't a great big deal because, gee, I'm going to help my cancer. But what we help people understand, at first, it's okay to mourn the loss. It's okay to say, this is awful. And to help people look at it and be okay with their feelings. One of the things I also hear people think is that they are going to need to love their body again. And that's a great goal, but you may not. And so having that as a goal, what we help people understand is they don't have to have that as a goal. You may not love your body again, and that's really okay. What we hope is for people to learn to feel strong, to move forward, to move through it, and to feel what they feel. And it's so, that's the main part.
Exactly, and I think something that's really challenging is that as women, not all of us love our bodies in the first place. So you're starting with a really challenging baseline. For example, around something like weight gain, which to a lot of women is a big shock that they gain weight during breast cancer treatment. The stereotype is that you lose weight and become skinny, but really a lot of women gain weight, and there are some biological reasons why women gain weight. Dr. Partridge, could you explain that?
Sure. Yes, it's actually more common to gain weight than lose weight after breast cancer, particularly amongst young women. It doesn't have to be that way, but it is hard. And it gets harder as you get older, and chemotherapy can be associated with weight gain, and that's not because we think people are sitting there eating more bonbons, but because women are generally less active during that time because of the fatigue or because of managing other side effects. And so the way to combat that is to stay active. Even if you're tired, you might feel better. And on the weeks you're not getting treatment, perhaps staying active. Hormonal therapy is also associated with weight gain, especially ovarian suppression, which we know is really good against the cancer. So we have to work harder, and we're already working hard, many women, trying to prevent weight gain. It's hard in our society, it's hard in our lives with cars and televisions, with remotes. We don't even have to walk to the television anymore. And so it's really challenging, but it's not an insurmountable problem. Staying active and, again, accepting kind of where you are in terms of your new body and what are new goals.
Ladies, what were some of the ways that you stayed active during and after your treatment?
I wasn't very active in the beginning of my treatment. I did whatever I felt gave me comfort. And a lot of that was through food. And it was the middle of the winter when I was diagnosed. And my friends and family wanted to make me as happy as possible during such a difficult time. So I definitely gained weight, probably a 5 to 10 pound swing. And since the weather's been getting better, I've been more motivated to work out and watch what I've been eating. But it is a challenge. But I think when you're really in those dark moments, you're going to turn to what you want to turn to feel better. So it's an ebb and flow, and eventually you come around. I'm feeling pretty good right now, but we're enjoying the summer. So it takes time.
Exactly, it does take time did you have something you wanted to add?
I actually had a different experience, I think, because I think I was so anxious and depressed in the beginning, and starting the chemotherapy, I actually lost quite a bit of weight. So that was a little bit scary too. And I just kept myself active really because of my babies. I mean, I had 3 kids and I didn't want to disappoint them. So for me, it was how am I going to take care of my babies first and then me second. So going outside, just getting fresh air, going for walks, and they really kept my mind off of things, which was helpful. So that happened for quite a while. It wasn't until my treatment was almost over that I actually started gaining weight. So post-treatment, you can also gain weight too, which is something that I'm struggling with right now too, because you do gain weight after your treatment is over. So that's been a little bit difficult as well.
Thanks, Kristen. And Dr. Partridge, how do you advise people who are trying to manage their nutrition and their exercise during treatment?
I think the most important thing, and you heard it from just 2 of our speakers, is you have to listen to your body, you have to eat what you need, and try not to overeat or undereat, and you want to try and choose nutritious, good foods. You want foods high in fiber, lots of fruits and vegetables, healthy fats, but we're all human beings, and some really bad for you things taste really good, and it's okay to indulge a little bit in moderation and to kind of, as you just heard, the ebb and flow is okay. And we can't be, my most important thing is don't be critical of yourself. You're doing your best in a tough situation.
Thank you. That's really true. And we actually have our first text question, which is it's somewhat related to what we're talking about, which is around the issue of sex and intimacy and connection with body image, and just how to feel good again as a young woman who may be going out into the dating world, may want to be able to engage in intimate activity. What advice can you give to a young woman who's trying to step out there and who may not be feeling very confident about her body?
This is to me. What we tell people is you do what you feel comfortable doing. What we also say, don't wait. Don't wait too long. If you want to, go for it. If your goal is to try to lead as normal a life as possible, then moving forward with that and taking risks is an okay thing to do.
And it's really scary. I would say one of the biggest questions that we get at Living Beyond Breast Cancer is, when do I tell? When do I disclose? Because a lot of times people can't tell that you've had breast cancer. What advice do you give to young women about when to disclose?
There's no right or wrong answer to this. Everybody does something that feels right to them at the right time. And I don't even think there's a right answer for one person and a different answer for another. It depends on the situation with the particular person you're dating, so that you can't really know that. But I think what people tell me is that it turns out to be much better than they thought it would be in terms of being honest. And I think that's really helpful for people to know.
Sure, and certainly everyone brings baggage into relationships, including the other side. So your breast cancer diagnosis may not be the only thing you learn. So now I'm going to shift gears a little bit to another issue that we sort of touched on at the beginning, which is menopausal symptoms, which covers such a wide variety of issues. And Dr. Partridge, could you just talk about what's covered under the rubric of menopausal symptoms?
Sure. So menopausal symptoms are generally symptoms that are attributed to either lowering or blocking of estrogen in a woman or man's body, because sometimes we treat male breast cancer and other cancers with endocrine therapies. And so when estrogen is blocked or lowered, there are symptoms that can come up predominantly driven by our brains, by those hormones. And these include hot flashes or night sweats. They include moodiness, and it can be cyclical or not, because not everybody goes into menopause, even if they're having menopausal symptoms. It can include, especially from the lowering of estrogen, vaginal dryness. And there are a lot of other symptoms, but those are the biggest ones that can impact, I think, on all women who are taking endocrine therapy, and particularly our younger patients who go from being in a state of very high estrogen, because they're not close to menopause, to being often in a state of very blocked or very low estrogen. And we think the worst part of these symptoms is when you have these abrupt changes, so high to low very quickly.
And of course, it's a very shocking experience as a young woman because you've never probably experienced a hot flash before, and what you know about it is what your mom went through or what you saw your grandmother experience. So, Julie, how do you speak with people or advise them about the emotional toll of menopausal symptoms?
Well, one of the things I find when I talk with people is that they feel that these are problems that can't be solved. And the fact is they can. They're hard problems to talk about, but they can be talked about. What our hope is that their oncologists bring it up, but if their oncologists don't bring it up, that they bring it up. Because there are some solutions to many of the problems that they're experiencing. So trying to force themselves to be honest about it and hopeful is a really important thing.
Can I add one thing?
Please.
I think the other thing is that many women attribute these menopausal symptoms to something bad. And the hot flash, what does it mean? What does it mean? And it means that you're getting anti-estrogen therapy or a blocker. It just means you're treating your breast cancer history or your breast cancer directly. And so I think sometimes there's misconceptions about what it means, or could it be a bad thing? And that can make people even more anxious. And so a lot of times what I'm doing beyond trying to treat the symptoms and helping them with sometimes medications or behavioral management of it, is to explain that it doesn't mean anything bad. A hot flash is kind of a natural phenomenon that happens when people go through menopause or when you block estrogen. It means the treatments are working. And people say, oh, okay. You know, it helps them somewhat because it's not something that's as anxiety-provoking then.
And Dr. Partridge, a lot of research in the past few years has been on extending hormonal therapy for more than 5 years. So we have a lot of young women taking tamoxifen for 5, 10 years or more. What is the impact on menopausal symptoms? Do they change? Do they go away? How does that work? What do we know?
Yeah, so the good news is we know from some very recent studies that women seem to adjust, or at least the women who stay on them. And so they tend to dissipate. A lot of it is about the change, and some of it's about the people who get used to it, their bodies get used to it, or it's about the women who are the most harshly affected come off because they just can't tolerate it. So it's probably a combination. But if you're still tolerating it okay at 3-4 years, and someone thinks it's worth it, you and your doctors, to take more, chances are the symptoms aren't going to get worse. They're generally going to continue to even out and be more manageable.
Great, thank you. So something I wanted to follow up on, everyone on the panel loves Dr. Partridge, she's a great listener. What if your doctor is not a great listener and you want to be able to talk about some of these menopausal side effects and how they're impacting you? What are some questions, what are some ways that young women can introduce that conversation with a doctor who maybe doesn't want to hear about it and says, you know, you need to take this tamoxifen, just take it and live with it?
I'll start, but I'm sure everybody else has something to say about that. So there are many fabulous doctors out there, including here at the Dana-Farber and around the world. So, you know, thank you to you guys. And I love to put my own patients on this panel because, you know, get that. I'm kidding. But the fact is that you should be told about side effects when you start a drug like this. And if you're not, at least someone should be handing you a sheet that says, here are the potential side effects. If that's not the case, then it is certainly appropriate to bring up, well, what kind of side effects can I anticipate? And if you're seeing someone who doesn't give you an answer to that, honestly, I'd find a new doctor. That would be the first thing. But most doctors will at least give you an answer to that. And I think it's really important. And especially if you run up against those side effects, how can I combat these side effects? And the doctors and the nurses who help to deliver a lot of the care in our follow-up clinics can really, and physician's assistants can really help with a lot of different management strategies. So definitely ask for help if you need it.
Thank you. And ladies, do you have any advice for some of our women about ways they can bring up this kind of conversation with their physician?
I feel like I've met quite a few women who are now good friends who have been through similar situations, and I just feel like you immediately develop a rapport with your doctor, and if you don't feel comfortable enough with that person, move on, because there's so many amazing doctors out there as well. And I just feel like when you're going through all of this, you get so much paperwork that I would just say, when do I have time to read all of this? Like, I just can't read it. If someone can't give me what I need to make myself feel better immediately, I just need to kind of move on. I would talk to John about it and say, can you read this? What do you think about it? And I really feel like you need to have a strong relationship with your doctor to feel successful, both yourself, with your family, and just, it's just so important to find that right person for you.
Thank you, Kristen. And I do have a great text question here. Dr. Partridge, could you speak to the difference between hormonal therapy and ovary removal as it relates to side effects?
So ovary removal and suppression of ovaries functionally cause the same side effects. One's permanent, ovary removal, and one is temporary medication to suppress them. So same side effects, and that's generally low estrogen side effects, hot flashes, vaginal dryness, and other menopausal symptoms. They're basically the same. One's permanent, one's not. And you can break through a little bit with the non-permanent one, meaning sometimes it's not complete ovarian suppression, but the goal is complete ovarian suppression, generally.
And psychologically, it's a little bit different, I think, for many people, because the actual removal of more body parts can be very upsetting to people. It's there's that.
Yes, and of course, removing the ovaries removes the ability to have children in the future, which is a significant impact for young women. Could you talk a little bit about that?
It is. I think young people are faced with something that's difficult to face as a young person before you're really at a point where you've experienced some of these things. And I think there's no way around it. It's very hard. We all learn that there are different ways to create families. Many of the patients will do all sorts of reproductive things before they have any of the treatment or before they have ovaries removed and things like that, so that there are options later on that might end up with biological children. So there's a lot of that sort of creative thinking that happens, but it's difficult.
Thank you, Julie. And if you're interested in more information on that, you can visit lbbc.org/young women, and we have quite a bit of information there. And I'm sure also at Young and Strong's website, you can find some information about fertility. So before we move on to the next piece, though, we haven't talked a lot about strategies to combat these menopausal symptoms. So Dr. Partridge, could you talk a little bit about some ways that women could combat these side effects?
Sure. So the first thing we try with most women is, beyond telling them what to expect, is behavioral side effect management, which includes dressing in layers for hot flashes and proactively trying to mitigate or manage vaginal dryness. And there are over-the-counter remedies available, lubricants and moisturizers if we anticipate that. Staying sexually active, if one is sexually active, is actually a good thing, because the more blood flow, the more activity, the less dryness. So that's a good thing. The partners really like me for that when I talk about that. And it's true. Those are two behavioral ways of managing it. And then there are medications we can add on to manage hot flashes. And sometimes we also will use a little bit of estrogen for vaginal dryness. But it kind of depends on the situation, and sometimes there are risks that we worry about with that, especially in the setting of an anti-estrogen strategy to treat the cancer. So that's a real personal decision with the doctor and assessment of the risk.
Okay, thanks for answering that. So now I'm going to shift to another issue of importance to young women, which is anxiety and depression. So Julie, this is a major area of research and interest for you. Speak with us a little bit about the risks to young women of experiencing anxiety and depression after a breast cancer diagnosis.
Well, when we meet any new patient, we do a full psychosocial assessment of the patient to get a sense of what the history is with any sort of emotional issues, what sort of depression, anxiety they've had in the past, what sort of depression, anxiety has been in their family, any sort of mental illness. what their history is of any trauma in their lives, earlier in their lives, what sort of substance abuse may have been part of their lives. All of those things are risk factors for any patient, and that's something we are very careful about understanding, because we can be looking out for them, and we can usually treat them more effectively and more quickly. I think young women have so many other kinds of issues to deal with that it's more likely they're going to be anxious about the future. It's more likely they're going to be anxious about what's going to happen in the future. And so what we do is offer them as much support as we can. We offer support groups. We offer matching programs where they can talk with other people who are in the same sort of situation. That turns out to be a really big help for people.
And of course, in some situations, medication may also be appropriate. Can you talk a little bit about that as well?
Well, what we normally do is in the assessment, we will determine whether or not we think a patient should speak with a psychiatrist, or we work with the team, the medical oncology team, to determine whether or not it seems to make sense to try out an antidepressant of some kind. And antidepressants help anxiety as much as depression, and it's sort of a misnomer. And people are always happy to find that out, because it's another way to treat it, and a pretty easy way to treat it. So sometimes we have trouble with people who are concerned about being on an antidepressant, and they're concerned about what that means and what sort of stigma that has. And when we explain what high percentage of patients are on antidepressants during treatment, it helps them to hear that. But we work with the team around that.
Thank you, Julie. And Anne, are there some other things that people can do, practical things to combat feelings of anxiety and depression?
Sure. So there are actually a lot of things one can do, including medication, as you just heard. Cognitive behavioral therapy is one of the best treatments for anxiety. And not everybody can get that in the short term. That's a complicated and long-term treatment, but there are some short-term fixes people can use to manage anxiety. Mindfulness, there's lots of apps online. But you have to be mindful enough to go find your mindfulness app. And so in the short term, we typically would refer to social work. We would help people to get enough information and use the exercise and other coping mechanisms. We don't want them to drink too much or do other, not necessarily healthy coping mechanisms. Sometimes we do short-term medications like Ativan and things, just for people to get through some of the more difficult, you have to go for a surgery, or you have to go for a scan, and it makes you really uncomfortable. Sometimes we'll do that too. So there's all kinds of ways we can help people in the short term. And then in the longer term, it's really a long-term management plan that depends on who they are and what we think they'll respond to and what they are willing to do or try.
One of the things I'd like to add is that what I hear a lot from people is that they're afraid that if they're anxious, they're going to make their cancer grow or come back. And so that there's another layer of anxiety on top of just normal anxiety that you'll have going through something like this. And so educating people on how your brain does and doesn't affect cancer growth is a really important thing. We try to help people look at the anxiety, look at the things they're afraid of, and work through them with somebody in a safe way. That pushing the anxious thoughts away generally does not work. And it's helpful to face them and move through them.
I just want to add, the other thing is, it's really normal to be anxious when you come and see me for the first time. That is completely normal. If you're at a cancer doctor for the first time and you're not anxious, I always look and say, when's she going to crack? What's going on there? It's really, really normal. And so what we're really talking about is people who are having a hard time once they get the information, once they get the plan, which is also not uncommon, but extra help can be brought in that setting. But for most people, once they get all the info about what's going on with their breast cancer and they have a plan to move forward, most people settle down and get to a place where they can cope pretty well. And it is also helpful to have the reserves and have the support, certainly for anybody. But most people are always impressing me that most people are pretty functional despite dealing with all the stuff they're dealing with.
Thank you. That's very important. And I wanted to kind of turn back to Alexis and Kristen. Both of you talked about when you're first diagnosed and the shock of that. What advice do you have for people who may be newly diagnosed in this room or who are watching on our webcast and who are really dealing with that initial fear?
Sure. When I was originally diagnosed, Dr. Partridge had prescribed some anti-anxiety meds, and I remember thinking, oh, I wonder what these are for, and then I put my head on my pillow that night, and I'm like, oh, that's what these are for. Because you really are alone. When your friends and family are around you, they distract you, but at the end of the day, you have to go to sleep by yourself in your own head, in your own body, and what really helped, those sleep meditations were great. But I also found on Netflix, I watched The Office. When I was up late at night and I couldn't sleep, I watched all 9 series of The Office. So it really distracted me. And when everyone else was sleeping and I was just wide awake thinking about my mortality, I needed something else to keep my mind off of it. So Steve Carell was very helpful. So I highly recommend finding a series or something that can keep your mind quiet at night, especially.
Thank you. Thanks, Alexis.
I would totally agree with Alexis. I feel like you do have a ton of support during the day, but it is at night almost as if you're a new mother all over again and you're up late with this infant like, oh my God, I'm the only one that's awake right now. That's how you feel, and it's something that's constantly on your mind. I have cancer, I'm in treatment, what's gonna happen to me, what's gonna happen to my family. So when you're alone at night, it really is so important to find either the support of a significant other, a family member, friend, a spouse, to just find some humor, get your mind off of it if you can, get out whenever possible, and try your best to just put it at the back of your mind and know you will ultimately be okay. It's just a short period. You just need to sort of find your way through it because there is that bright light at the end of the tunnel.
Thank you, Kristen. And I just want to give John an opportunity to speak about the impact on you as a caregiver emotionally and your experience with that.
Thank you. So I personally suffered from panic attacks and anxiety attacks for the past 20 years, and I've dealt with them. I've tried every form of medicine, and finally found one for the past couple of years that have really helped me. When Kristen was diagnosed, I thought to myself, I'm gonna go off the deep end because they started becoming more frequent. And being by myself and alone at times, whether it was at work or home and she was resting, it was really, really tough. So I think I purchased every self-help book possible. And I found that just reaching inside your soul, inside your mind, and really doing it yourself instead of all these other books, because I just felt I was reading the same thing over and over again. And I would have my days where I just said, let me just sit down and just breathe, whether it was, I'm not big into yoga, but if I did a little 15 minutes of yoga, it helped, and it helped me really get through those really difficult times.
Thank you so much, John. And I wanted to bring that up so we could talk just a little bit about what caregivers experience and what kind of supports we have for them. This is true for all caregivers, but obviously with the way gender roles are, sometimes men don't know how to ask for help or don't even have the language to ask for help. What are some things that we can do to support caregivers who are trying to help the people that they love?
Well, first of all, we consider the caregivers our patients also. And we look at the whole family and say we want to support everybody in the family because everybody's dealing with this in a different way. And so what we talk to caregivers about is how important self-care is, and that you can't get through this if you don't continue to take care of yourself physically, emotionally. We offer counseling to caregivers, independent counseling. We offer support groups. We recognize that there's this need for caregivers to try to solve problems. And so for caregivers to begin to understand that they can't solve the problem, but what they can do is be present and be able to hold, if they can, the feelings of their loved one. But they need their own help in order to do that. So asking for help is really important.
Thank you, Julie. So now I want to transition to another issue. I was listening to you guys talk about those late nights and putting your head in the pillow. And so let's talk about fatigue, which is something that strikes a lot of young women for a variety of reasons. And just to start off, Dr. Partridge, could you explain for folks who may not understand how fatigue related to cancer may be different than just the normal fatigue you might feel as a young person after a long week of work or being up with your kids?
So the difference between cancer-related fatigue and just plain old, I'm tired because I'm burning the candle at both ends or had a really long day, is that cancer-related fatigue doesn't get better with rest. It's pervasive, and no matter how much you sleep, it still doesn't feel better. It's a very well-documented phenomenon. I think somewhere between 20 to 40% of cancer survivors at some point complain about cancer-related fatigue. First thing is to make sure that nothing else is going on. So you got to make sure someone's not having chronic pain, anemia, hypothyroidism, low thyroid hormone, which helps drive depression. Thank you, very important. So you want to have a good evaluation of, is it cancer-related fatigue, or is it something related to the cancer but not cancer-related fatigue? Once you've figured that out and obviously treated the problem if you find one, you're left with cancer-related fatigue, which can be due to the history of treatment. It can be due to ongoing hormonal therapy, things like that. And then the treatments generally are exercise, mindfulness, yoga, and some complementary therapies and supplements can be helpful, but you got to pick and choose and run them by your doctor. And I would think also management of anxiety and things like that.
Yeah.
Glass of wine.
And a glass of wine's nice.
The other thing I would say is that we try to help people understand that it's okay. They can cut themselves slack. They can give up some things that aren't so important. And that doesn't mean that they're weak, that they're failing at being a breast cancer patient. It's okay to not do the dishes as quickly as you might have. During holiday seasons and things like that, we have a lot of people who feel like, I've got to make it just the way it's always been. And the fact is, you don't. And often what I find is when I talk with people, they say, I did it really differently because I just didn't have the energy to do it. And it was better. We discovered something that we liked better that just took a lot less energy. So being able to prioritize is really important.
Thank you. So I wanted to ask sort of a related text question that someone brought up earlier in the program, which is how to deal with unwanted advice. This individual was asking about specifically nutrition, and that people will give unwanted advice, take this and it'll cure cancer, so on and so forth. But this is the kind of thing that obviously keeps people up at night, because people who are well-intentioned and really meaning to be loving and think they're being helpful may not be as helpful as they realize. What are some ways to deal with that?
I think people can be very direct. Patients can be very direct. If they don't want the advice, they can say, thanks, but this doesn't really help me. I appreciate your caring, but it doesn't help me. What I'd really prefer that you do if you want to help me is come take a walk with me, or something else. But it's okay to be, this is your time. You can be as direct as you want to be.
Great. Does anyone have anything else they'd like to add on that?
I would just say that these days, we're dealing with lots of well-intentioned, though as one of my colleagues would say, dangerous people when it comes to some advice. And we also have Dr. Google, who, can be helpful. I even go to him and her sometimes too. But I think really in the end, in terms of your medical treatment, you are the lead, but you've got a team, hopefully, that will help you make the best choices for yourself, for both your body and your mind. And the rest of the advice, you need to be able to pick and choose. It's kind of like the 60s in my mind. If it feels good, do it. But if it doesn't, thanks, but no thanks.
I do remember one of the first things that you said, Dr. Partridge, was try to stay off the blogs and stay off the website, and don't read too much because it's just going to drive you crazy. You'll hear horror stories from other people. And I think for the first few weeks or maybe a month or so, you were constantly on there looking. And I just remember Dr. Partridge saying, stay off. And
Shut it down for a
Shut it
while.
down
Yeah.
and just kind of go off what your body is telling you and just...
Well, it's certainly important to limit it. I know we sometimes advise people on a related note to give themselves 15 minutes of worry time a day, spend that time worrying, and then don't allow yourself to do it the rest of the day. So there's lots of strategies and ways that you can kind of control that, because you can fall down a rabbit hole with Dr. Google for sure. So another issue that's come up is around pain. And Dr. Partridge, I'm wondering if you could talk a little bit about the types of pain that women report, and what you can do about that.
So in short-term, pain can be related to local therapy, surgery or radiation, or it can be related to chemotherapy, especially drugs like the taxanes, which can cause painful neuropathy over time. And so, the job of your provider is to pay attention to that and assess for pain. And we're actually getting pretty good at assessing for pain in clinics. But as you get further out, people may not assess anymore. So you need to say, hey, I'm still uncomfortable here. Is there something wrong with this or not? And then the decision about whether or not you need a treatment is something that you'll have to, depends on what it's due to. But there are many different types of pain, but pain is not normal. It should be attended to and oftentimes treated in the setting of a diagnosis or treatment of cancer.
So certainly we hear a lot about vaginal pain as a side effect, and you should not be having that. What are some ways to manage that?
So with vaginal dryness, that can lead to painful vaginal activity, or people can just have pain without activity because of just the normal walking and being around in life, or urinating. People can have some irritation at the end. And so the ways that people can deal with that is to try and make sure that the vaginal area stays relatively moist, and you can use non-hormonal moisturizers on a regular basis, and then an as-needed lubricant. So there's two different classes of substances people can use. Moisturizers are like moisturizing your face. They use it a couple times a week. You're supposed to moisturize your face daily. And then the lubricants are as needed in addition. Those are just two ways. And then if someone's having very severe pain, first, obviously, you should be examined and make sure from a gynecologist there's nothing else going on, have any infections treated if there's anything like that. But the other thing that people often use with some success is actually lidocaine, which is a local anesthetic. There is a topical gel that can be used in the vagina and can help with vaginal pain. And there are some other remedies too.
Thank you. And another pain issue that I wanted to bring up is neuropathy. Since many young women will take a taxane, which is often associated with neuropathy, what are some things that women can do who may be experiencing this?
Neuropathy is a really big problem, particularly with the taxanes. And first, as people are being treated, you need to pay attention to it, and if it's going beyond a little bit of numbness and tingling, you really have to weigh, do we keep going with this drug? Because the worse it is, the more frequent it is, the not going away between cycles, the more likely it is to stay, and it can even get worse after you finish, if there is a finishing time for the platinum or the taxane type drugs in breast cancer. And so first you need to think about, is this worth it? And oftentimes I will stop someone's taxane a little bit early when we don't think the risk benefit is worth it for that person, depending on what their disease is. But if we do, or we didn't stop it early enough and they're left with some painful neuropathy, there are remedies. So acupuncture can help. Some other complementary therapies can help. And there's a drug called duloxetine, which is actually an antidepressant, which has been studied and can help with painful peripheral neuropathy. So those are just a few of the things that we try.
Thank you. Thanks for sharing that. And actually, you reminded me of a question we got earlier in the session. You were talking about the benefits versus the side effects. We had a text question about hormonal therapy and how do you weigh whether to continue on a hormonal therapy versus the side effects you might be experiencing. Can you talk about that a little bit?
Sure, and it's like any decision in the treatment of anything, and breast cancer in particular, is there's choices. And in breast cancer, in some ways it's good. It's not like acute leukemia. So you get leukemia and it's treatment or unfortunately you're gonna die from the cancer. That's not the case with many people with early stage breast cancer. There it's treatment and you will lower your chances of hearing from that cancer again. And it's an odds game. And so a person who has really low risk breast cancer and really high burden of symptoms, it may not be worth staying on the hormonal therapy for that person. A person with a really high risk breast cancer and that same burden of symptoms, it might be worth it for them because the risk reduction might be enough to warrant tolerating the side effects. And so it very much depends on the risk-benefit ratio for a given individual, which has to do with how they feel on the treatment, as well as the risk of their cancer to begin with, whether they really, really need the therapy and how much do they need it and what's the incremental benefit. And it's tricky because not everybody's great at explaining that as physicians and providers, and not every patient can really understand all that, partially because we don't explain it that well.
It's a lot of information to take in. Julie, did you want to add to that?
The other thing I want to add to that is that often people are starting hormonal therapy when they finish active treatment for breast cancer. So they've had chemo, they've had surgery, maybe they've had any one of these things in radiation therapy, and then they recover a little bit and start hormonal therapy. So what we find sometimes is it's hard to tease out what anxiety and depression is coming from. Often there are physical symptoms that people have and assume it's the hormonal therapy, but very often it's anxiety and depression that they assume is coming from the hormonal therapy. But what's important for people to understand is that when you finish active treatment for breast cancer, often you can be more anxious and more depressed than you were going through it to begin with. And so you're doing two things at once. You're finishing active treatment and you're starting a new medication. And so it's really important to be very open and talk with your team about it, to try to tease out what's really happening.
Thank you.
The other thing is that the majority of people, and we've studied this in young women, a lot of young women are understandably, and women in general, are afraid of the side effects of hormonal therapy, even more so than chemo, which is really interesting, or at least they express it more. And the fact is that most women are going to feel okay, and are going to be okay from the side effects, and maybe have some, ones that are tolerable. The vast majority of people are not miserable, and so, kind of getting over that hump and saying, okay, I'll try it, and if I am miserable or really suboptimal, we'll come up with another plan. I think that's the important message to communicate for me to my patients.
Absolutely. Thank you, Dr. Partridge. So we have a few minutes left, and we have a number of text questions. So we'll talk about a variety of things for the next few minutes, but I wanted to direct my next question toward our panelists in the back. So we have a question about whether you shared your diagnosis with your friends, family, and colleagues, and how you did that.
I did, but it was a process. So obviously my immediate family knew, and once I started to get a little bit more comfortable, I wasn't comfortable, but a little more aware of what was happening, this was reality, I started to share with my close friends, and then it slowly started to spread out gradually. I did feel like I had control over it, and I think that's the biggest part about it. You have no control in this situation, and the little control you have is so important. So the way it spread out seemed pretty organic to me. I told my colleagues pretty soon after I was diagnosed. It was very important for them to know what was going on, but I felt very supported. And another thing I want to bring up, because I think this is really interesting, another cancer patient mentioned this to me, you'd be really surprised at the people that show up when you're going through this, peripheral people in your life. And it's meant so much to me. But also on the flip side, you might have a strong network or core of good girlfriends, and maybe some of them don't show up. And that's really difficult. And Julie and I have talked about that. so it's managing the people that are coming forward and also managing the people that maybe are taking a step back. And my sister always says, if you don't show up now, when do you show up? So it's been a lot easier to take a step back from people that aren't coming around. So.
Sure. Yeah. It's so true what Alexis said. John and I are both very private people just by nature. I think it's probably the teacher and me too that kind of keeps a lot of things to myself, but I felt like after my diagnosis, I just somehow opened up to obviously our family first and foremost, and then slowly friends, and I just pretty much got it out there almost immediately because I felt like we needed the support with, a growing family. We have a large family, but it's interesting to see who's really there for you when you need them the most. We would have thought that our large family would really come together and help us as much as possible, but it really can be neighbors, friends, and colleagues who are there for you more than anyone, and it's really eye-opening to see who's there for you. We had people delivering meals to us.
That we didn't even know.
No, just in our town alone who had found out, and it was just overwhelming, and we were just so grateful to have these people who had heard through other people, our friends, that helped us so much just by a listening ear, a meal, taking our babies out for a quick walk and giving us a break. So it's incredible, the people that want to help you that you would least expect.
Thank you both very much. And the next question, actually, I think, Julie, you'll be interested in this one. How do you deal with controlling parents who just want to be involved in my cancer journey every single day? I feel like I became a teenager again.
It's a hard problem, but I think being honest is really important. And one of the things, parents feel helpless. Parents want desperately to do something. They feel like they don't have any control, and they want control again. And what we often tell people is, tell your parents what they can do to help you. Give them jobs that will help them feel like they're part of this journey with you and feel like they have a really important purpose. So that may not be coming over every day. That may be not coming over every day. That may be don't call me twice a day, but maybe once a week. Sometimes just being able to say to a parent, what I need now is to feel independent like I have for the last 5 years. And it's really making it difficult for me to feel like I can't do that anymore. Please try to give that to me. So that kind of honesty is really important.
Thank you.
I think it's important also to remember, as if you're the patient, that it's generally coming from a place of love. And not only does that parent feel out of control, they're probably scared for you. And so trying to at least help them to understand what you're dealing with on an intellectual level may help them emotionally, and making sure they're also supported. So that, and saying that, you could get some help around this too. Meet with my social worker. Come in with me, hear the facts from the doctor so that you too can feel better. Like, I'm scared too, join me in this, but this is what I need.
Thank you. And it's hard to believe it, but our hour is almost done. So I have a closing question that I would like to address to all of you and give you an opportunity to make some closing remarks. So I'm going to start with Alexis and ask you this question. Imagine that you're talking to a young woman who's just been diagnosed with breast cancer. What is the one thing that you would want her to know as she begins her experience forward?
Yeah. I would say there's really no right or wrong way to go through this process. It's whatever feels right to you. And I think the number one thing is trying to deal with anticipation. When I was first diagnosed, I thought I was going to have an early stage breast cancer. I thought there's no way I'm going to be stage 4. I'm too young, I'm healthy. And I had anticipated what that was going to turn out to be. I'm going to have surgery, I'm going to have radiation. And I worried, and it turned out that that wasn't my reality. I have metastatic breast cancer, and so I have to deal with other things that come along with that. And then I worried and anticipated about chemotherapy, and I realized that experience was different than what I was worrying about. So just trying your best to manage it day by day. It's challenging. I'm anticipating my trial that's coming up next week, and I'm trying to practice what you preach. I'm trying to be present and mindful that I don't really know what's going to happen, but I'm going to take the steps to get through it. So just whatever feels right, go with it. Try not to anticipate too much.
Thank you, Alexis. Kristen?
I think, as Alexis said, it's absolutely more than normal to just feel devastated, be in disbelief. How did it happen? Why did this happen to me? You ask yourself all those questions, and it's totally normal. But again, you as an individual have to find what's best for you, how you feel, express those feelings either with yourself or with someone else. Don't go through it alone. There are so many people that are out there, whether they're part of your inner network or people at your facility, your doctor, who want to be there to help you. So take advantage of some of those. And it's okay to be scared. I still think about it every day. And I've read about celebrities who have gone through it, and they say the day will finally come where you won't think about your cancer. That day hasn't come for me yet, and I'm not sure it will for a long time. And it's totally normal. So you just go at your own pace, do what you can do, and just stay strong and just keep believing that you're fighting your best fight and you're doing the best you can.
Thank you, Kristen. And John, what would you say to a caregiver who's facing this?
I mean, for me, it was being by Kristen's side for every one of her treatments. I was there for every one of her chemo treatments, her radiation treatments. And I just felt that I couldn't let her go alone. So for other caregivers out there, if you have the ability to do it through work or you have vacation time, just to be there and be by her side and go through it. And, you know, when Kristen was losing her hair, we decided to shave it together. And she had asked me, do you mind shaving my head? Because it finally got to the point where she just couldn't keep it. I said, that's fine, and you can shave mine. And we just kind of went through it together, and I just thought it was the best way for us to cope with the dark days that you have.
Thank you, John. And just one last question before I have you do closing remarks. What if you really feel you don't have a social support around you? Because we definitely have gotten some texts here from folks who feel like they don't have anyone. As a young person, they don't have anyone to help them. Where do you suggest they start?
I think they should start with their providers and their care team and the social workers at their center. And if that's not enough, or there isn't as well resourced a center as we're fortunate to have at Dana-Farber and other big centers, then there are so many supportive opportunities online, like Living Beyond Breast Cancer, and there are other advocacy groups and that people can turn to, and there's chat rooms, and there are one-to-one connections through the American Cancer Society, or do you guys have that? Do you have that? A one-to-one connection where you
We
peer
do.
support?
We have a breast cancer helpline, and we can connect you with a young woman who's had breast cancer.
Yeah. So I would reach out to those kinds of things.
Thank you. Julie?
And other medical facilities where you are, even if your medical facility doesn't have support groups and that sort of thing, you will very likely find support groups in other hospitals near you. So being creative and looking around, you can find things, certainly online, but you can find the real human part too, if you look.
Thank you, Julie. And I would also say that, as our panelists have said, you'll be surprised by the people around you. They don't have to be blood relatives. They don't have to be a partner. There are people around you who will be helpful to you. So before we close up, Julie, do you have any last things that you would like to say?
I think the thing that I try to impress upon people the most is that they should drop the word should while they're going through cancer treatment, that there is no should. You should not feel that you should feel something. You should not let anyone tell you that you should feel something, that you feel what you feel. There's no right and wrong as you go through this.
Thank you. And Dr. Partridge?
And I would just add that be patient with the process. Both for those who are newly diagnosed, going through treatment, in survivorship, living with chronic disease, It really is a process. You will get through it.
Thank you. Thank you, Dr. Partridge. Thank you, Julie Salinger, Alexis, Kristen, and John. Let's give them a hand. They've been wonderful panelists tonight. I want to thank everyone who participated this evening. This recording will be on lbbc.org. We encourage you to go to the websites of both our organization and Dana-Farber. You can reach Dana-Farber at dana-farber.org. And if you type in Young and Strong, the program will come right up. And I want to again thank the Centers for Disease Control and thank the entire team at Dana-Farber for their amazing partnership on this program. You have been wonderful partners. And I'd like to thank all of you. Please fill out your evaluation, whether you watch this online or you're here today. Have a wonderful summer and a wonderful evening.